Hi, I'm Ruby. I'm going to be your nurse today.
Hi, Rubes.
You're here for
An exam for work.
awesome. And your name is?
Haley Pate.
And do you know what the date is?
Today is December 8th, 2025.
Perfect. Thank you. Okay, I'm just gonna let you know that you will be gowning on and off of your gown, and that we are gonna like do some hard like sharp touching too also when we do this, just so that you're aware.
Okay.
Okay. All right. I'm gonna do your vitals. Thank you. All right. And these are within normal limits. Perfect. Gonna check your respiratory, make sure you're breathing. Perfect, symmetrically. And then we're gonna go ahead and just check your skin tone. The color looks good, your appearance looks good. Perfect. I'd like to go ahead and move on to your head and face. Right, so we're just checking the symmetric of the face. We're making sure that her skin is good, no lesions. Gonna check your head to make sure there's no bumps. Do you have any headaches?
No.
Okay. All right, there's no bumps there. That's also within normal limits. We're gonna just check and move your eyebrows up and down, squint your face, grimace, right? Smile, and then puff your cheeks. Stick your tongue out. Perfect. Thank you. Okay, we're gonna go ahead and move on. Oh, I forgot to just check right here for your TMJ. Can you open your mouth and close it? All right, a little pop, just a little. Okay, we're gonna go ahead. Let me write this down. Okay, we're gonna do, I need my pin light. Check your eyes now. Okay, for Perla. Okay, just look forward. Pupils are at 3M. 3M on both. Okay, I'm gonna just check. We're gonna palpate here, the forehead, your eyebrows, eyes down, and then I'm gonna do your lacrimals. Okay, I'm also gonna palpate here at your spectrum. Yeah, that. And then I'm also just gonna make sure. We're gonna go ahead and palpate your carotid. We're gonna do your thyroid, and then okay, everything feels really good. Gonna go ahead down and palpate here. Everything looks good. Okay, we'll bring your gown back a little bit. Okay, we're gonna do the eyes now, to where I'm gonna just have you follow the pin this way. Keep your head still, straight at me, perfect. This way, and down, and up, and then also, perfect. Okay, all right. Also, can you see over here?
Mhm.
And over here?
Mhm.
Okay, good. All right, we're gonna go ahead and let me write that down.
You put your hands up on both sides.
I did not.
You did.
Oh, okay, good. Okay. All right, I have a piece of paper that I guess we'll just use this one. All right.
Oh, was it this one?
Oh, yes, thank you. Great. All right, I'm gonna have you cover this eye, and I have a chart. I'm sorry, I'm gonna get out of the way. We have a Snellen chart over here, and we're just gonna have you read the first letter,
F.
and then the third line down.
9, 2, 4, 7, 6.
Beautiful. And then can you put that on the other eye? All right, and what does that say on the third line down?
9, 2, 4, 7, 6.
Thank you. Okay, and then let's check your near vision. Okay, just go ahead and read.
A, 6, 7, B, D, E.
Thank you. Perfect. Okay. All right, and your eyes are white. The conjunctiva is white. That was my Snellen chart. It fell. I'm sorry. And then we're also going to make sure that you're not jaundiced, which you're not. Okay, and the iris is good. All right then. Eyes look great to me. We're going to go ahead and move on to your ears. I'm just going to check the arc of it. Going to check the symmetry. Just going to push this back a little bit and pull up. The same here. Pull up, pull down, and to the side. I hope I'm not in her way. Okay. I'm just writing this down. Okay. If I had an otoscope, I would go in and I would look to see for the pinkness, but I don't. And then we would do this one, and then also we would just look at the inside eye of the eye for the iris. Okay. All right. I'm just going to use this pen as the otoscope. I would look up your nose to make sure there's no blockage. It looks good. Okay. And we already palpate the sinuses. And then,
I didn't have any pain or anything when you did that.
no pain. Good. All right. And then we're just going to open your mouth. I'm going to look at your tonsils, your larynx, and I'm going to have you say, ah. Perfect. Thank you. All right. Okay. And then I am still looking at these lymph nodes going down and palpating the side. Okay. All right. I'm going to write this down. I forgot to check the gag reflex. You can gag. Perfect. Thank you. Okay. The lips, the teeth, and the gums all look within normal limits. All right, we're going to go ahead to the neck, inspect the neck. It is good. I'm going to have you tilt your head back, tilt it forward, tilt it to this side, and this side. Perfect. Now I'm going to do that with resistance. Go ahead and push. Perfect. Thank you. And then push this one. Perfect. Thank you. You would do it bilaterally. Okay. Now we just want to make sure. All right, the anterior cervical and super clavicular are all good. I've already palpated the thyroid. I've already checked the trachea, and the neck range of motion is perfect. We're going to go ahead down now to the chest, inspect the shape of your chest is good. It's symmetrical. Okay, at this time I would just like to bring this down to this side. We can just do one side. That's fine. She can see. Okay. Everything is symmetrical. I'm going to go ahead and have you take a deep breath for me and then let it out. Okay. All right. This would be done on bare skin because I've already told you that we were going to take the gown off. All right. We're going to palpate your axillary lymphs, which are over here. I'm going to have you lift this arm up. We're going to do it over here. Perfect. Thank you. Okay. We're going to listen to your lungs. You would breathe in and out. Breathe in and out. I'm going to go down. Okay. And here. Okay. Okay. All right, perfect. I'm going to bring this over you just a little bit so that you're not exposed. Okay. Okay. All right. I'm going to go ahead and go to the back. So can I have you turn for me, please? Perfect. And I'm going to go ahead, bring your hair over here and bring this down. We're going to take the gown down so I can look at your back. Okay. Hair over. Going to have you, can you turn a little bit more, Haley, because I have to be able to, thank you. That's good. All right, so go ahead and take a deep breath. We're going to feel this. Okay, let it out. Good. And then you're going to breathe in, okay, and then out. Good. And then can I, hold on, I'm going to put my stethoscope back on. Okay, can I get you to say 99?
99.
Good. Again?
99.
Good.
99. 99. 99. 99.
Good. Okay, I'm going to whisper in your ear for you to repeat what I say. That's going to be blue box beard.
Blue box beard.
Okay, can you say it a little bit louder so I know that she heard you?
Blue box beard.
Thank you so much. Okay, perfect. You can go ahead and stay like that for a moment. Okay. All right. Just going to percuss. Okay. Then I'm going to palpate. Everything's good. Okay. All right, and I'm just gonna have you turn around back to me with the gown down so I can do the front. Perfect, this is great. Okay, so then I'm gonna percuss. I don't hear anything dull. Okay. Okay. Right in here. Okay, perfect, thank you. Okay, gonna go ahead and listen to your heart. Okay, sounds good. Okay, I'm gonna go ahead and listen to the 5. Your aorta. Okay, it's kind of hard to get in here, Haley.
I know.
Sorry.
It's okay.
Okay, and I'm blocking you. Okay, so we're doing the mitral valve, the tricuspid, and the pulmonary, sorry, can't say it, pulmonic. Thank you. Oh, I didn't do Erb's point though. So then Erb's point would be from here down to here to find that chest is somewhere. Okay, and then it would be right there. Okay, thank you. All right. Okay, I'm gonna write these down. Everything looks within normal limits. Let's go ahead and put your gown back on. Sorry.
Thanks. Just have me naked over here.
Okay. All right. Cardiac is good. The pericardium. We've done the heaves and the thrills. Normal heart sounds are expected. Okay. So now with your breast. Okay, this would be done in bare skin. And I would have you lift this arm up, and then we would palpate your breast, okay? And you would do a breast exam, basically. And you're familiar with doing that, okay? All right. Right. The abdomen region, would we be able to lay down for that?
Yeah.
Okay.
How would you like me to lay down?
Right here is good. Perfect. I think we're good, yeah. Okay. All right, I'm gonna go ahead and move the drape. Are you okay?
Yeah.
Okay. All right. So with the abdomen, we're just gonna make sure that we'll listen to all vowel sounds. Vowel sounds are present in all 4 quads. Okay, I'm just gonna inspect it first, which there's nothing here, so I can inspect it. Everything looks symmetrical. There's no lesions on the skin, no bruising, no redness. Then I would palpate mild, soft, mild, and then hard on all 4 spots, looking for any abnormal for hernias or for liver lesions. I would be feeling there. And then I would make sure that we percuss in all 4 quads, which we're doing, okay? At this time, since I have her like this, I'm gonna go ahead and just examine her hips, make sure that they're symmetrical, which they are. Let me write that down. Okay, sorry, are you okay? Okay, good. All right, no tenderness, no guarding. She was able to accept that with no problems, okay? I'm gonna go ahead and have you sit right back up, Haley, okay? Perfect. Okay, we're gonna go ahead and, yep, you're fine doing that. Okay, we are gonna inspect your arms for range of motion. Okay, so we're just gonna do the one side instead of both so that I'm not in the way of the camera. Anyways, you're gonna lift this arm up, okay, down, bring it down, and then up to this side, and then back. Perfect. Can you bring your arm to your nose, and then back? Perfect, okay? And the same with that is what you would do bilaterally, okay? I already checked your hips. We're gonna do the knees. Okay, go ahead and lift. Bring that up and down, okay? She's not gonna be able to see. Yep, up and down, okay? And then we're gonna go ahead and scoot back just a little bit so she can see your ankles, if that's okay. You're good. Perfect, okay? So you're gonna dorsiflex them, and then back, and then fixate, and then out. Perfect. Okay, and there's no tenderness behind the calves?
Nope.
Okay, perfect. All right, and then are you able to bring that knee up? I know you just did this, sorry. Go ahead and bring it down. Perfect. Okay, there's no edema, and I would check for cap refill. I would check for cap refill, which is fine. Okay, then you can go ahead and scoot back to the edge of this table right here. All right, I'm gonna do the same with your hands. We're gonna check for the cap refill. Okay, or that's perfect also. Oh, push and pull. So you'll push my hands. Okay, perfect. And then I'm gonna have you hold them. Yep, perfect. Okay, we're gonna go ahead and do that with the feet also. Push, good. And then pull, good. Okay, all right. Let me write this down. Okay. Then we have, oh, your back, okay? I guess, okay, we gotta turn you that way. I know there's a lot of turning, I'm sorry.
Oh, no, that's okay.
Okay, can I drop your
Certainly.
the gown? Perfect, okay? So we're just looking at it right now, just inspecting it. Everything looks mid-center. I'm just gonna feel these. They feel fine. I'm gonna go ahead and percuss a little bit here between these. Good, okay. All right, you can go ahead and put this gown back on. Thank you, okay. I'm sorry.
How do my shoulders look?
They are fine. Yeah, they're symmetrical and there's a little bit of tightness
I've been doing
Okay.
pull-ups.
because you've been doing pull-ups. Okay, you can go ahead and turn around. Okay. All right. Okay, so now we're going to do our mental status. I already asked you what your name and what the date was. Do you know what your birth date is?
10/2/97.
Okay. And do you know where you are?
Yeah, I am in Mogador.
Perfect. Okay, and then your speech is coherent. I'm gonna go ahead and check your reflexes on your popliteal. Beautiful, beautiful. Okay, we're gonna do your biceps. Okay, right. Gonna check the reflex on that. Okay, and I just stood in the way, so you would do it bilaterally. Okay, your Achilles back here. Sorry, and that's good. Okay, and then I want to use this to check your sensory of your skin. Okay, so it's going to be a light touch. Okay, well, this will be the light touch. This will be sharp. Okay, go ahead and close your eyes.
Okay.
Okay.
Light.
Okay.
Light.
Okay.
Sharp.
Okay. We'll check down here
Sharp.
and over here.
Light.
Beautiful. Okay. All right. We did the upper and lower strength. I want to go ahead and do the finger to finger. So you just start with your thumb and go like this. Beautiful. Okay, that's all normal. Normal. Okay. All right, now we just want to have you get up here so that we can check your gait, okay? I'm going to move this back, and you're just going to walk towards that end of the room and then back to this end of the room. Okay, meanwhile, I'm just checking her gait, which is perfect. She's going to come back to me. Perfect. I'm going to have you back up just a little bit, and I want you to bend down just to touch your toes. Beautiful. You can come back up. Okay, and then if you could put your arms out like this and close your eyes, okay? And then bring them into your nose. Bring your hands to your nose. That's perfect also. Thank you, okay? All right, you're done, okay? Then we can have you sit back up on here. Okay. Thank you for letting me take care of you and do your assessment. We will report all of this to your doctor. I mean,
Thank
to your
you
work.
so much, Nurse Ruby.
Thank you.